Okay, so diagnostic tests can also include urine testing. So some general information. The body makes about 1 to 1.5 liters of urine every day. Generally, if you're properly hydrated, you would put out the amount of urine equal to the amount of fluids that you take into your body. The role of the kidneys is to regulate the dilution or concentration of the urine and to regulate the excretion of sodium. So that helps maintain fluid balance as well as electrolyte balance. Normally, urine is sterile. The first morning urine is best for testing since it has the most concentration. So things have been sitting overnight and they're not been diluted out throughout the day. To do a urine test, we may do what's called a dipstick. It looks like a strip of blotter paper. It has different types of reactive chemicals depending on the type of test. So the procedure is the dipstick is dipped into urine and then we observe it for color change. The urine properties are measured by the dipstick. So it will look at bilirubin, glucose, hemoglobin, ketones, leukocyte esterase, nitrates, and the pH protein. So here we have a photo of a dipstick and the different colors and then what that means. So we use a fresh urine sample and we can stick it, capture it in a sterile cup, put the dipstick in, and then verify the reference chart. Now, different things about urine. Urine is a liquid. Liquids have what's called a specific gravity, or an SG. We compare the specific gravity of all liquids compared to distilled water. So distilled water has a specific gravity of 1. Urine is going to be heavier because it's got things in it, dissolved substances. So when we look at it, the measurement of the specific gravity help us identify the kidney's ability to concentrate the urine, how hydrated the patient is, and the amount of the solids that are mixed in the urine. So when we look at the specific gravity values, the normal value is generally 1.003 to 1.035. Most patients, it's going to be between 1.01 and 1.025. So we've got a little expansion on that range, but it's pretty specific. For concentrated urine, it's going to have more particles in it, so it's going to be heavier. It's not going to have as much liquid. It's going to have more of those salts and those dissolved products built in. So those are going to have more weight. So if it's above 0.25 to the 0.03 or more, if the urine is concentrated, it could be first morning urine is going to have more of those salts dissolved. So it could be a little bit heavier. Now later in the day or after drinking lots of fluids or something that has a diuretic effect like beer, some alcohol can cause your urine to become more dilute, and then it would be 0.01 to the 0.001 to 0.1. Let me say that one more time, tongue-tied here. 1.001 to 1.01. Now, the concentration measures the ability of the kidneys to concentrate the urine when liquid is withheld from patients for several hours. So if we do this test, then it should come out a little bit elevated, but in the normal range of 1.02 to 1.025. Now, different reasons that we have concentrated urine and things that can interfere with the test would be acute renal disease, bone disease, chronic liver disease, and hypercalcemia, elevated calcium levels. Other things that can interfere with test results include hyperparathyroidism, potassium deficiency, and low salt or low protein diets. Now, the color of urine can also identify different things in a testing. So the normal range of color is a light straw color to an amber color. Abnormal colors can mean different things. So if the urine kind of has a black, it could be due to Lysol poisoning, alkaptonuria, hemoglobin in the urine, or melanin in the urine. If it's brown, it could be due to Addison's disease, which is a deficiency of mineral corticoids, blood or hemoglobin in the urine, bilirubin, medications, including muscle relaxant called methocarbamol, which is Robaxin, rhubarb, which is a root, I guess technically it's a vegetable. It kind of looks like celery, but it's red. Sometimes used to make pies. Very good. Other medications in the phenylytic class, and then possible melantonic tumor. If the urine is clear or nearly clear, it could be due to alcohol ingestion. So I was saying it becomes dilute when people drink beer or extra alcohol. Chronic interstitial nephritis, diabetes insipidus, which is a condition where there's a lack of antidiuretic hormone. We talked about that in the endocrine system. Diuretics, pulling more fluid, large fluid intake, nervous or excitement, reduced perspiration, it's going out in the urine, or untreated diabetes mellitus. Other abnormal colors, orange, can be indicate the urine is very concentrated due to decreased fluid intake, excessive sweating, or medications can cause the urine to be red or orange. Medications such as phenazopyridine, which is pyridium, which can be used for a urinary tract infection, can cause the urine to be a orange or red color. Red urine could be a result of chemicals in the vegetable of a beet, blood or hemoglobin in the urine. That would be fresh, where if it was brown, it would be more, blood would be coagulated blood. Medications, methemoglobin, and then oxyhemoglobin. Now, the smell or the odor associated with urine can also identify different things. Generally, normal urine result of volatile acids. It isn't really an offensive odor. Usually when we have a very strong odor, it could potentially expose that there is something wrong. Now, an ammonia scent is usually due to stale urine. It could have bacterial activity. Generally, when we're talking about babies and diapers and that ammonia smell, it's due to stale urine. It's not due to an infection. There's also sometimes a sweet smell or an alcohol type smell, and that could be a result from diabetic ketosis or diabetic ketoacidosis, and those ketones falling out into the urine. And then for another type of condition, there is maple syrup urine disease, or where urine has a kind of a maple syrup scent. It is a metabolic disorder. It's a condition where the body can't break down certain proteins, and it leaves that sweet maple syrupy smell. In urine testing, we may also check the pH. The pH of the urine is controlled by the kidneys to help maintain the homeostatic pH in the body, which also helps maintain the pH of the bloodstream. Now, bloodstream pH is generally about 7.4. Now, your urine is going to be kind of in that more, as an adult, a little bit more on the acidic side, in the pH range of 4.6 to 8. Usually the average pH for an adult is 6, which is slightly acidic, 7 being neutral, 8 being more alkaline, and small children, their urine tends to be more on the alkaline side of it. Now, pH can also be changed by respiratory acidosis, which causes excessively acidic urine. Causes of acidic urine can also include dehydration, diabetes, mellitus that is uncontrolled, diarrhea, high protein diets or starvation. Sleep disorders can also affect breathing, which can cause respiratory acidosis, which can then affect the pH of the urine. Urine that is alkaline, greater than 7, can be caused by pulmonary diseases that cause hyperventilation. Other causes of alkaline urine can include chronic renal failure, renal tubular acidosis, salicylate intoxication, and urinary tract infections. Now, talking about infections, we can talk about how cloudy is the urine. That's known as turbidity. So if it's got kind of a cloudiness or a component that it's not like very, very clear, normal values, it's usually clear to slightly hazy, especially it depends on what time of the day. In the morning, it may be a little bit more hazy than at night. Again, we're going to have more particles in the urine. But cloudy urine could be caused by bacteria in the urine, an infection that results in pus, or having blood cells, like red or white blood cells in the urine. Can be caused also by rapid cooling, which has those dissolved salts falling out of the solution. Ingestion of certain foods that are especially greasy or fatty foods can cause more turbidity in the urine. And then there could be vaginal contamination, which happens in women when they're trying to give a urine sample, not so much in men. Now, here we have the picture out of your book. So we have the examples of the different colors of urine. So this is a very dilute urine. This is more of that straw color. So in the morning, you're probably going to be in here, maybe creeping towards here if it's very, very concentrated. And over here, we have turbidity. So you see this is very, very clear, and it's getting cloudier as we move through the samples. Now, some of the things that can be identified in urine include glucose. The normal level of glucose in the urine should be less than 5 milligrams per deciliter, or 0.5 milligrams per deciliter. I keep messing up those decimal points, don't I? A glucose test is used to detect diabetes, also to confirm the diagnosis of diabetes or determine the effectiveness or treatment of diabetes. Other causes for glucosuria include stress, low kidney reabsorption of sugar, and also the patient's diet. We can also look at the protein levels in the urine, specifically albumin protein. The normal values are 50 to 80 milligrams every 24 hours. And a continual excretion of the protein in urine is often indicative of renal disease. Temporary proteinuria can be a result of bathing or swimming in cold water, eating a lot of protein, having severe emotional stress, or violent or intense exercising can increase the protein output in the urine. Renal diseases can lead to chronic proteinuria, and those can include kidney stones, nephritis, polycystic kidney, tuberculosis or cancer of the kidney, kidney failure, as well as diabetic nephropathy, or damage to the nephrons in the kidney due to diabetes. So, talked about ketoacidosis, there are ketones that can come out in the urine, and acetone is one of them. You may have heard of acetone. It is one of the things that is sometimes used in fingernail polish, but it is a chemical and it is a ketone. A ketone gets released as a result of the metabolism of fats and fatty acids in the body. If the body runs out of carbohydrates to burn, it will switch to the fats. These ketones can then go into the bloodstream and out through the urine. through the process of the urine formation and the glomerulus and the nephron back in that chapter talking about the kidney function. Ketonuria is usually associated with diabetes and diabetic ketoacidosis. It can also be an effect of types of diets. When there are ketones or present in urine, some of the things that could affect it include anorexia, not eating, diarrhea, drugs, medications such as insulin, fasting, and fever. The not eating with the anorexia and the fasting, the body's going to turn to its fat stores and break those down, which causes the ketones to be made. Also, post-anesthetic can cause elevated ketone levels, prolonged vomiting and starvation, and very low carbohydrate, high fat, high protein diets, because breaking down those fats leave those ketones behind. In the urine testing, if there's turbidity, we perhaps would be looking for bacteria. In a normal urine test, there shouldn't be any bacteria. It should be negative. If there's even a small number, it is usually indicative of a urinary tract infection. The examination is you look at the sediment of the urine, and you can use that to diagnose or make a prognosis of the types of infections. So looking at those tables out of the book, we have the different things that we look at with urine testing, the color, what the different possible causes of the different colors may be, as well as the test results, the other test results, and their causations. Basically all the slides that I just went through. Now, if we're looking at the specific gravity and we find that it's decreased, we could have too much fluid, not enough of those solid particulates. If it's increased, we may have dehydration, not enough fluid. Sugar could be a result of diabetes, stress, and turbidity could be due to fatty foods or rapidly cooling the specimen. Vaginal contamination or with bacteria could be an infection.